Hi guys, my name is Jaswin. I'm from Kaisar Pharmacy and I will be explaining on oral contraceptives. So what is oral contraceptives? Basically, they are birth control pills to prevent pregnancy. There are two types of oral contraceptives. We have the combined oral contraceptives and also the progestin only contraceptives, which are also known as mini pills. So for oral contraceptives, we have two sex hormones that we need to know lah. We have the estrogen and we have the progestin. So combined oral contraceptives contain both estrogen and progestins. And how it helps in preventing pregnancy? Number one, it will prevent ovulation, which is the release of the eggs from the ovaries. Number two, it changes the lining of the uterus to prevent pregnancy from happening. And number three, it changes the mucus of the cervix, which is actually the opening of the uterus. So this will prevent sperm from entering into the uterus. For progestin only oral contraceptives, it suppresses ovulation but not all the time. However, it will increase secretion of the mucus and reduce the thickness of the endometrium lining. So when we compare combined oral contraceptives and progestin only contraceptives, combined oral contraceptives are more effective in reducing pregnancy. Oral contraceptives are effective methods of birth control, but they don't prevent the spread of HIV or other sexually transmitted diseases. Okay, for oral contraceptives, we have either monophasic pills or biphasic pills. So monophasic pills, basically they will have the same ingredient with the same dose in each tablet. Whereas biphasic pills, usually the packaging may come in a 28 tablet packaging where 21 tablets will be a different color and the remaining 7 tablets will be a different color, because the different color also signifies different dosage in the tablets. So basically we have packaging that comes in 21 tablets, some come in 28 tablets, and certain brands may even come in 91 tablets. So because of these different brands, they are taken in a slightly different manner and they may come with different risks and benefits as well. So for 21 tablets, how do we usually take it? We take one tablet once a day, every day for 21 days at the same time. Usually to prevent nausea and vomiting, we can take these tablets with milk or also take it with food. So during the 7-day period, we don't take any medication, and after 7 days, we start back with the treatment and repeat the cycle. For 28 days, we take one tablet once a day, every day, according to the sequence that every packaging usually will have. And once we are done with our 28 days regime, we can start a new packet the day after you take your 28 tablet. So they may have different colors for these 28 tablets, as I mentioned before. Usually the last 7 days or the last 3 days, the color may be different because it may signify less amount of estrogen in the pill or no active ingredient at all. Usually it doesn't have any active ingredient. If it does, it might just contain folate supplements. For 91 tablet, you have to take one tablet daily for 91 days, and once you are done with 91 days, you have to repeat the cycle again. So usually for this regime, the last few tablets during the end of your course may be different color because of the lower level of estrogen in the tablets or no active ingredient at all. Moving on to the most important question: when do we start taking the oral contraceptive pills? Usually for oral contraceptives, we start taking it on the first day or the 5th day of our menstrual cycle. However, we can also take it on the first Sunday of our menstrual cycle. For example, if our menstrual starts on a Thursday, we can take our first tablet on the Sunday to make it easier for us to schedule our 28 days for the regime. However, if our menstrual cycle falls coincidentally on a Sunday, then we can start on that Sunday itself to make it easier for us to create the pattern. However, it is important to note that for the first 7 to 9 days of taking our oral contraceptives, this birth control method is not 100% effective in reducing birth control. Therefore, you will need an additional birth control method to prevent pregnancy. For those who are taking 21 tablet regime, whereby you are having a 7-day period of not taking any medication, during these 7 days, you may experience a menstrual period or withdrawal bleeding that is similar to menstrual period. However, for those who are taking 28-day regime, they may not experience a scheduled bleeding. However, they may have unexpected bleeding or spotting, especially during the beginning of the treatment course. How do you know which oral contraceptive is best for you, since there are so many oral contraceptives out there? Number 1 is your menstrual cycle. For those who have irregular menstrual cycle, it is important to consult a doctor and let the doctor decide what is best for you. Also, for those who have any health related problems, especially dealing with cardiovascular health, it is best to actually consult your doctor and also discuss with your doctor which regime might be most suitable for you. Another important aspect of choosing an oral contraceptive is whether you are breastfeeding or not, or if you are on any other medications. So all these are also taken into consideration when deciding an oral contraceptive. There are some side effects that comes with oral contraceptive, mostly with the estrogen related oral contraceptive, which is the combined oral contraceptive. So these side effects may include reduced libido, spotting, headache, or also breast tenderness, but these side effects usually fade away after some time. There are more serious side effects such as blood clotting, but these are all low risk side effects and don't really occur in most people. For those who are breastfeeding, the best option for oral contraceptive would be the mini pill or also the progestin only pill, because progestin hormone will not reduce the production of the breast milk, whereas estrogen hormone can actually reduce the production of breast milk. That's why it is not suggested for pregnant women. That is all from me today. I hope all of you learned something new today. Thank you.